Good morning and welcome to today's Resiliency Call, After COVID Telehealth Reimbursement with Oregon Representative Rachel Prusak. TO is excited to continue our conversation around resiliency with this 5-part series on digital health running Tuesday mornings at 8:30 through the month of June. I'm Riley O'Brien, VP of Events and Experiences at TAO, and I'm joined by Ruthie Ditzler, TAO's Marketing and Regional Program Coordinator, who's providing back-end support on Zoom. A couple of rules of engagement before we start. All participants have been muted, and we ask that you remain on mute unless a TAO staff member unmutes you or calls on you to talk. You may ask or respond to questions in the chat box publicly or privately by directing your message to Ruthie or I. Ruthie's under the special events name. We'll monitor the chat box and respond throughout the discussion. And we ask you to engage via the participant icon on your screen, which you can raise your hand, answer yes or no. You can also add reactions like a thumbs up or a clap when something resonates with you. Please engage with us on social media during this call and throughout the day. We love to share what's happening with TAO and get participant takeaways from our events. And due to the limited time, we'll capture all questions in the chat and shift any unanswered questions in Mobilize. Mobilize is TAO's member-only virtual community, and we'll post unanswered questions there to keep the conversation going after the event. If you have any questions about joining Mobilize, you can reach out to Justin Martinez, whose email is on the screen. And if you have any questions about joining TAO, please reach out to membership@techoregon.org. We invite you to join us tomorrow morning at 8:30 for our next resiliency session with Ian Goodhue, Head of External Relations for Google in the Pacific Northwest, to hear about the exposure notification tool using technology to help stop the spread of COVID-19. A huge thank you goes out to OCHIN for underwriting this series. We appreciate their sponsorship and are excited to explore topics related to digital health with them. And finally, it's my pleasure to introduce Oregon Representative Rachel Prusak and OCHIN's Executive Vice President of Government Relations and Public Affairs, Jennifer Stoll. Jen and Pam, the floor is yours.
Thank you, Rayleigh. It's a pleasure to be with you this morning. For everyone on the call, I'm Jen Stoll, lead government relations for OCHIN. OCHIN is a national nonprofit health IT and research collaborative helping underserved communities access technologies, and so everyone has a fighting chance for health equity across the country, regardless of your ability to pay. So that being said, thank you to the Tech Association, Skip, Rayleigh, for the opportunity to be part of this important conversation around healthcare resiliency in the state of Oregon. It's been extremely impressive to work with healthcare providers throughout the state and watch how quickly the provider community has been able to build out technologies and adapt to the COVID-19 crisis. Last week, we were able to have a Representative Pan Marsh be with us to discuss broadband access and really thinking about broadband as an equity question and a potential social determinant of health. If you don't have access to broadband, you can't participate in many programs. And so how do we close that digital divide and how do we build resiliency around broadband? This week, we are very fortunate to have with us Representative Rachel Prusak. Representative Prusak represents House District 37 and has been a tireless champion for the healthcare community around access to other technologies such as virtual care to be able to reach more patients and close the divide, the digital divide, both urban and rural for underserved populations. So with that said, I wanted to start off the conversation with Representative Prusak and ask her not only as a provider, as a state representative, but as a nurse practitioner, you work really hard to deliver care to the state's most vulnerable population. Please tell us about your work and serving this population and what you've been seeing during the COVID crisis.
Thank you, Jen. Good morning, everyone. Representative Rachel Prusak here. I want to thank Technology Association and OCHIN for having me, and I'm excited to share my personal and professional experience with you all. So I am a nurse practitioner, as was mentioned, a family nurse practitioner. I've been a nurse for over 20 years and a family nurse practitioner for 10. I work at House Call Providers, and we serve homebound elderly and disabled. So seniors who wouldn't otherwise be seen because of mobility or dementia, we see them in their home. So a lot of people see that as the old school way of a doctor visiting your home, but now we have a group of nurse practitioners, physician assistants, and physicians who do that. And, you know, we had to transition to telehealth, telemedicine visits, just like everywhere else. And so as a state representative, fighting to increase access and not have it pass last session and then have everybody cut to post-COVID, having to get up and running really quickly, and what barriers some of us face that weren't already set up, and how we're working now, and the improvements that we need across the state to make sure that everybody can access telemedicine is what I've seen up front and personal over the past 2 months. And the barriers that exist for serving the senior population, you know, these are patients who have difficulty with vision, have difficulty with hearing. And so we're very used to being close to them, holding their hand during visits. And so how do we make sure that these can be the best visits they can on a time like we have now?
Thank you, Representative Prusak. If you could share with the group a little bit about how your work has changed. You touched on it a little bit about moving from in-person physical contact to virtual. Can you elaborate on that a little bit more and talk to us about what you do to make sure technology isn't a barrier in that space?
Sure. So ultimately now I see it as a lifeline. When we were having these conversations before, it was how do we make sure those in rural Oregon, those that are homebound, those with behavioral health issues can access care through telemedicine, telehealth, virtual visits. And now we see it, the curtains have been pulled back, and it's not just part of the visit or part of care, it is a lifeline. For many patients, coming out to the clinic would impact their life and death situation, given that if you have a chronic condition, you're more at risk. And so we need to make sure that we protect our communities, especially our vulnerable communities, like our seniors and others. And so I've seen how much it helps being able to see my patients, where in the interim of trying to get up on telemedicine, we were doing everything by phone. And I've seen the barriers, and I want to fight and make sure and work towards making sure those barriers are addressed, so that we can serve our vulnerable populations. One of the barriers includes, for instance, if I am serving my patients in a long-term care facility, how do we make sure somebody is in the facility to help assist with those visits? And right now, there isn't a set plan everywhere. And so I think innovation in those areas is going to be really important.
Thank you. Thank you for that. In the legislature in the 2020 session and prior to that, those sessions, you were an ardent supporter of reimbursement parity for telehealth services. Tell us a little bit about that and what this means to you for reimbursement parity. Has your thinking evolved since COVID? Kind of frame that for us a little bit more about the reason you're so passionate in this space.
Yeah, it's become more important than ever. So I fought for it pre-COVID, knowing that it would increase access to our vulnerable populations. And now, as mentioned, COVID-19 has pulled the curtains back, has shown us the cracks in many of our systems, including our healthcare system. And so telemedicine is more important than ever. So pre-COVID in the legislative session, we were talking about how low reimbursement rates resulted in a barrier to use because providers were hesitant to shift their models to adopt telehealth more broadly, resulting in less patients being served, right? So as mentioned, if you have transportation issues, if you live in a rural area, if it's hard to get in because of your chronic conditions. Post-COVID, what we know now is that without payment parity, clinics won't survive with the low reimbursement rate we currently use. So a lot of the opposition I had when I was fighting for this has shifted to support. So organizations that were worried that payment parity would impact, say, their bottom line, versus looking at improving access and caring for our communities are now saying, oh yes, we need this. We need to make sure that we have payment parity so we don't see clinics closing across the state. And, you know, the main important reasons why telehealth parity policies are the answer is that care is care regardless of modality. And as mentioned, telehealth overcomes these geographic barriers and now overcomes barriers that come with a pandemic, which we weren't talking before, but now it's one of the most important things. And I think we have to think about what is the future of our healthcare. And I'm somebody who's been practicing outside of the four walls for a while now. And I think we're going to see more broadly that the future is many people practicing outside of the four walls. And how are we innovative in that as we move forward?
Thank you very, very much for that. And thank you for your passion in this space. We're very lucky to have you in the legislature. And so thinking about policies that also help support your patients, you know, are you going to continue to support these policies? What are you thinking in terms of legislative strategy? And tell us your thoughts on a potential an upcoming special session. What are your thoughts around that?
So as far as policy, we had a couple of, you know, short-term fixes because of COVID-19. So for example, in response, the Oregon Health Authority extended reimbursement parity for services delivered via telehealth to better serve the Oregon Health Plan and Medicaid patient population. And with full reimbursement, they suffered much less damage to their bottom line that had these services not been covered for this current event, we would not be where we are right now. So we need to make sure that that is extended. We need to make sure that people continue to be able to access telehealth services. And if we were to go back to the reimbursement rates pre-COVID, people wouldn't be able to do that. So I mean, I've been pushing for a special session for a while now. There's a lot of things we have to address in policy, and a lot of my colleagues have as well. And I know that we're being careful given the pandemic. We're making sure that we have are dotting our I's and crossing our T's before we get there. Given that it's not that we're in Salem and we can debate back and forth and be on the House floor and in committee hearings. So I think that's why it's taking some time. But what I know for sure is that one of the policies that I'm advocating for, and again, thankfully now I have a lot of people along for this to support this when pre-COVID I didn't, but really just extending that payment parity, making sure that we can continue to care for our patients. And as we keep the reimbursement and the payment parity, we also talk about how we can invest and where we can use money to innovate to make sure that those that don't have the proper services can build them.
Great, thank you. And I want to encourage all the participants, we've got a great turnout today, to please chat your questions in the chat box. We'd love to hear from you, and you know, have questions for Representative Prusak. So the last question I have for you is, as we are working together today with the Technology Association, how can the association help you? How can the tech community come together to rally around to support your efforts, but also help close that equity divide that you're seeing for patients?
So whenever I get this question and I'm talking to groups advocating for something, I always talk about how important it is to reach out to policymakers, write to your state representatives, write to your senators, form a coalition of people who are thinking and advocating and have passion for the same things that you have. So in this case, how do we work together to make sure that we learn together, we innovate together in technology and in payment. We are seeing what's behind the curtains, and we can't stop now. We need to make sure that any policy that was set in place because of COVID, we get to say, you know what, why weren't we doing this before? And we need to stick to it, right? So there's a lot of things in healthcare. I'll give one other example. I know it's not technology based, but it came to my mind. As a nurse practitioner, I can prescribe any type of narcotic. I can be your attending when you're in hospice care. I practice primary care, palliative care, and hospice care. But I can't refer you for home health. This very simple thing. It's a Medicare rule. So this was another thing that was waived to make sure that everybody had access to home health during this time, specifically in very rural areas where you might be the lone nurse practitioner, physician assistant caring. And so what I'm saying to that is, we're not going back. We need to make sure we fight. If we could do it because of a pandemic, why couldn't we do it before? Why can I prescribe insulin? And why can I prescribe morphine, but not home health? So I think that COVID-19 policies that come up because of COVID-19, for example, payment parity, how we can innovate during this time. We can't say that it's just a fix until we get a vaccine. We need to say, this is helping with health disparities. This is helping the inequities of serving our most vulnerable community members across the state, and just continue to work together. Now that we see the problem and we know the solution, how do we make sure that we focus on patient care and patient access?
Great.
And I'm ready to keep fighting. And so whoever is with us today can reach out to myself or Representative Marsh, who was on last week, since we're working closely together, because we need both. We need the innovation for telemedicine, and we need to solve for the digital divide and make sure that everybody has access to broadband. And then we need the people that are on this call that know how to innovate and say, hey, let's talk about these long-term care facilities that may not have the best access. Let's talk about how we're going to serve our rural Oregonians, and everybody work together and solve for this problem that we've seen with the curtains being drawn back.
Great. There's a couple of questions in the chat, and thank you for that. The first question is around remote patient monitoring, which is a very good question. And the question comes from the idea of, what can the state do to make policies? What kind of policies can the state drive around improving access to remote patient monitoring?
So, I mean, what I know about remote patient monitoring as a primary care provider is, if my patient has heart failure, then they are linked to, say, a scale, they are linked to a blood pressure monitor, and a nurse or somebody is monitoring that to prevent hospitalizations. Not only are they costly, but they cause a lot of suffering for families. So, whether you care about the morals and ethics and humane treatment of our patients, or you care about saving money, right? We all are going to fight to make sure that patients are monitored and prevent those things. So I know that only a handful of my patients use that. And that is also something set up through home health and through your payer. And so I guess what I would say to that is having more conversations with the state about how potentially they can innovate to make sure we encourage more payers to include that as part of their service, right? So while they're having to discuss and evaluate how they provide telemedicine, they're obviously going to have to discuss how they provide and use remote monitoring. I know that it's used for our most complex patients, which is what I serve. And so how do we use it more widely? I think that's a great question and something that we should bring up more. Thank you for that.
Well,
I don't know, can you answer anything to that, Jennifer?
Well, actually, there's a really interesting question around, from Robert Gluckman around, wouldn't a prospective payment for a population be a better solution?
That's a great question.
Primary care practices should be able to operate on less administrative expense by adopting telehealth. What are your thoughts around maybe remote patient monitoring and other policies and looking at different payment structures?
That is a great question. So I fought really hard to create a work group around universal access to primary care. And part of that conversation, I just chaired the first meeting because COVID-19 had slowed down the process. But after the first meeting, the two biggest things that came out of it was how we transition away from fee-for-service and how we make sure that everybody has access to telemedicine and remote monitoring. And so again, something that I've been advocating for a long time, as well as others, but until COVID-19 hit, people were kind of dragging their feet. Providers and systems were dragging their feet of how they move away. But now that we have groups of providers and medical groups saying, wait, if we don't move away from fee-for-service, how are we going to survive? How are we going to continue to keep our doors open? Because for so long, we've only been reimbursed by what we do, when there's so many things that we do that we're not reimbursed for to keep our patients out of the hospital, to care for our communities, to care for our vulnerable members. So I think that is the other piece of this, is how do we see value-based payment, capitation, and per member per month, however you want to look at it. And that's what we need to decide. That's what we're going to try to figure out in the group. And how is telemedicine, virtual visits, part of that, right? So I've always said it's never going to take the place of for some of our patients, but it's going to be part of the continuum of care. And it's not only going to increase access for our patients, it's going to improve providers' well-being. We work so hard to care for our patients with the barriers and limitations we have, because this is why we went into it. But we need to solve for the things that aren't working, and that would be our payment structure and access to telemedicine. Top two, for sure.
Great. A couple more questions from the chat. These are great questions. Please keep them coming. What changes, if any, and this comes from Kelly Hagan, in the licensure requirements for providers addressing telehealth need to be addressed on a state or federal level?
Can you ask that one more time? I'm sorry. I got distracted by the chat box. I need to not look at it.
Sure. What changes in licensure requirements do we need to make regarding providing telehealth for providers? What are your thoughts?
Okay, so are we talking about like an Interstate Compact? Is that one of the things that you're talking about? So this was something else that's been talked about for many years, but it wasn't until COVID-19 that Oregon entertained how we look at that and how we say, if you are a provider in Oregon, or you live somewhere else, but get your license in Oregon, that you can care for patients in Oregon. So that happened because of COVID-19, where nurse practitioners and other behavioral health specialists can get their license here and care for patients here. It's not happening in all states. And I'd say, just like the other things we're talking about, once we're through the other side of COVID-19, we need to make sure that we continue to engage in this and not go back and say, unless you live here, you can provide care here. We need to make sure that we're helping each other out. Patient care, provider care, we have a workforce shortage, and that shouldn't impact patient care.
Great. So Monica Seidel states that we should, when we distribute remote patient monitoring equipment to our members of our insurance company, we have to be very careful to avoid the risk of inducement by providing free equipment. Are states working together to expand federal safe harbor to minimize these barriers to access and make it easier to deliver this form?
Yeah, I don't know the answer to that question, but I can look at that if you send me the question later and get back to you. Again, I'm, working as a nurse practitioner, family nurse practitioner, serving my patients and also serving my constituents. And right now, a lot of the high level things that are happening is making sure my constituents are cared for, making sure they're getting unemployment, making sure they're getting rental assistance, while we work to make sure that the state continues some of these policies that came up. But what other states are doing, I'm not sure. I don't know if you can help answer that.
I think, at least from the OCHIN lens, what we're seeing federally is there's a lot of conversation around telehealth. What do we keep? What do we, as the CARES and COVID have opened up a lot of different policies, there's a lot of conversation happening about what do we keep? What do we change? What safe harbors we need? So it's all part of a larger conversation around increasing access to care and building capacity. So I don't know if we have a solution, but I know it's part of the conversation right now about safe harbor. And that also includes provider safe harbor and, thinking about things in a more global manner. Great. The last question I see in the chat box is around state reimburse for PERS through Medicaid. I'm not sure if I fully understand the question. Let's see. The Medicare has CPT codes that cover the cost of RPM equipment. Are there codes for installation training and the third for monthly monitoring? And what we can do as well, we will definitely aggregate these questions and be able to find formal responses to these questions if we don't have the answers right at this moment. Do you have anything you'd like to comment around PERS and Medicaid or PER? I don't think that's the same PERS, sorry. I think Personal Emergency Response Services, thank you, in Medicaid. Do you have an answer to that?
No, but we can look into that one.
Excellent. Well, I know we're getting close to the top of the hour. It's 8:57. And I want to turn it back to you, Representative Prusak, for closing remarks to the Tech Association community today.
Oh, thank you. I guess I will just reiterate how important this topic is, how important you all are in solving for the needs that our communities have. I can pass policies, and I will be fighting to make sure that everybody can have access to telemedicine, have access to remote monitoring equipment when needed, so that we can serve our communities the best in this time and moving forward. But you all are tasked with making sure that you continue to innovate for solving this and come up with solutions that I can, use when we're fighting for policy. How do we work together? So really, again, I can't stress how much, policy and tech can cross paths, and to reach out to your representatives, form a coalition, figure out how we can answer some of these so that we can care for our most vulnerable among us. And I look forward to hearing from any of you.
Great. Thank you for your time today, Representative Prusak. Riley, I'm going to turn it back to you, and thank you for all that participated this morning.
Yes, we really appreciate all of you being a part of our session this morning. And we invite you to participate next week, same time, same day, where we'll be talking with Max from One Community Health on digitizing the patient experience. And you can find that information at techoregon.org/events. Thank you again, Representative Prusak and Jennifer. We really appreciate all of your great thought leadership, and we look forward to connecting with everyone soon. Thank you.
Thank you all.